Okay, so I have Joe Cody here with me. He is an IVF advocate, IVF dad, and fertility company founder.
Yes.
And he is my first guest on the Fertility Stories podcast. So I'm so excited to have you here with me.
I'm incredibly honored to be the first guest on this. This is going to be a fantastic series that I think is really going to help people. So I'm quite honored to be a part of it.
Awesome. Well, Joe and I have worked together a little bit before, so we know each other a little bit from working together, but I'm excited for him to share his story. And I think it will be a really unique perspective because when I first started the concept of filming this podcast or recording this podcast, I kind of, I had in mind having women on as the majority of the guests. But then when you popped into mind as a guest, I thought it would be an extremely unique perspective to have you as an IVF dad sharing your story from a male perspective. So yeah, I'm excited. I'm excited from that sense to have your story shared.
Thanks. I appreciate it. And I think it's one of these things that in the fertility world, so often we think of it as something that only impacts the woman as they go through it. And the unfortunate reality of our biology is a disproportionate amount of the impact is on women with having to go through the medication. They're the one who has to do all the appointments. They have a lot of stuff to manage. But from, a spousal perspective and trying to support my wife as we went through everything, it was really important for me to figure out ways to try to reduce those burdens as much as I could. And I was uniquely suited to be able to help with some of the other aspects of infertility that are some of the worst parts, the insurance aspects, how much does it cost, managing all the health records and all the other impacts that it can have. And that really adds to the stress level. So we were very lucky in that regard. And so it's really important for, I think, men and women to be able to tell their stories. So I appreciate the platform.
Yeah, wonderful. All right. Well, my first question for you is just kind of before your fertility journey started, something I think about a lot is I have always been somebody who has always wanted to have kids. And I remember when I was little, like 7, 8 years old, thinking like, I want to be a mom. I want to have a ton of kids. And that's something that I've talked about with friends and family. There's always a difference there in terms of like I have a few friends who want to have kids now but haven't always felt like they haven't always felt like, oh, I've always wanted to be a mom, but in adulthood have kind of grown to make that decision. So I'm curious, from a male perspective, is that something that you always thought about, that you always wanted to have a family, or is that something that kind of developed later on?
No, it absolutely was something. So I'm from St. Louis, Missouri originally, and I come from a large Irish Catholic family. So I have five siblings. I have close to 40 something first cousins between my mom and my dad's side. Both of my
Yeah.
parents have 6 and 7 uh, brothers and sisters, respectively. So I'm used to a large family environment, always thought that was the norm. And my wife
Mhm.
is the same way. She comes from a large Irish Catholic family, too, from the Northeast area. So she grew up between Connecticut, New York, New Jersey, Boston area, and she has a ton of cousins also. So we both had this expectation of, okay, we would have multiple kids, although it's, a different environment for our generation compared to our parents or our grandparents. We both grew up in those types of large supportive households that had a lot of siblings, a lot of people running around all the time. And that was the way that we always imagined our life together going. And as many people who listen to this know, the unfortunate reality was the diagnosis of infertility changed all that. And it was a really hard thing for the two of us to come to grips with. And, it's something that we still talk about a lot, lamenting the loss of not having this ideal family that we both imagined, and being able to have siblings for our daughter. I'm very lucky to have one child through IVF, but that process took us 4 years to get to her. And she will still make comments to us saying like, oh, asking if she's going to have a sister or a brother, or she make jokes because our nephews live in our neighborhood. And she's like, oh, when they get older, they'll be my brother. And we're trying to
Yeah.
have that, but it's tough for that from the parental perspective, but also from the child perspective. And it's a big thing you have to deal with as you go through infertility.
Yeah, definitely. Okay, that's a great perspective on it, and yeah, that's a challenge, right? When you have this idea of what you think things will look like, and then it doesn't exactly turn out that way. So, with that being said, when you started trying to conceive, did you have this idea that this is just going to happen right away, or what was your mindset going into it?
Yeah, so our journey is unique in that, we got married and then we started trying to have kids, and as we were going through, my wife actually was diagnosed with Crohn's disease in right when we were starting to conceive, right after we got married. So there was this, health interruption that took place, and that seemed to kick off a number of things as we went through, but once we eventually were having trouble, we went to our OBGYN and they referred us to a reproductive endocrinologist. We eventually, received the diagnosis that my wife had diminished ovarian reserve. And, you know, I naively thought that, okay, like I know the statistics. I looked up on CDC websites, what the chances are for a person at our age to be able to have success. But I thought we were going to be fine. And
Mhm.
when we went through our first cycle of IVF, we actually ended up having a positive at the start after the 2 week wait. So we had several weeks where we were actually hopeful that it had worked on our first time. It ended
Mhm.
up not coming to fruition. It was a chemical pregnancy, which was our first loss as we went through everything. But we felt very, you know, despaired over that loss, and we thought we were going to be able to be the ones who were one and done, and then we can continue to go through the process, and like you mentioned earlier, have that large family that we were imagining. There are so many people who are successful and do go through multiple rounds of IVF to have multiple children over the course of a number of years. We thought we would be
Mhm.
able to be one of those people, but unfortunately that wasn't how it all played out for us.
Yeah, okay. And before you started IVF, did you try any other methods like IUI or anything like that? Kind of walk me through the journey of how you got to IVF.
Yeah, so unfortunately, once we got the diagnosis of diminished ovarian reserve, our doctor said immediately going to IVF.
Yeah.
That was going to be the only method we would able to conceive if we weren't going to use gestational surrogacy or adoption, or some other means of trying to expand our family beyond just the two of us. So we didn't go through a lot of that, and the diagnosis itself necessitated a slightly different journey than a lot of other people went through. So it wasn't like we were able to go through trying to egg bank and do all this other stuff like under people were or
Mhm.
who do go through their own journey deal. So we basically, it's like a monopoly type thing. You can pass through, you skip go and
Mhm.
go right to something else. And that was the way our journey was, which was both, I think, good and bad, because there are so many people who are forced to go through multiple rounds of IUI, but they know the unfortunate reality is their chances are probably very low that that will be successful. We know statistics on IUI versus IVF,
Mhm.
but for people who have insurance coverage, that's often a step that is required to go through the
Mhm.
process. So
Uh,
we were lucky in that regard, where we got to immediately go towards something that increased our chances the best scientifically possible, but
mhm.
it did also complicate things in other ways and added a ton of expense and time to our journey.
Definitely. And I think that is a little unique in a sense because, based on the stories that I've heard, people that I've talked to, a lot of people, like you mentioned, do have to go through that. Like they'll try like 4 rounds of IUI, and there's a lot of disappointment in
Mhm.
that. So if you feel good about, just going straight to IVF, like you said, I feel like that can kind of um cut out a lot of that disappointment if, if that was what was recommended by your doctor to just kind of go straight to IVF. Yeah, so that's a unique situation in that sense. And a lot of people, also I think
Mhm.
it's interesting that your wife got diagnosed with Crohn's before you started the journey because then a lot of people will kind of start to uncover like once you do start having problems when you're trying
Mhm.
then they're like okay is there another diagnosis that we're missing here and that can be that can be hard within that journey to to then uncover other medical issues?
As we've learned more about everything, and then as I've, talked with patients, trying to build grand fertility and working with people through Resolve, one of the things that was enlightening to us, but I think also disheartening, was when we look back at our medical records, we actually saw warning signs way before everything happened. When my wife, she also has thyroid issues, so she was getting her hormones regularly tested. So
Mm.
dating back to when we first started dating or before that, you could start to see diminishing reserves. You could see AMH levels starting to change. You could see other stuff that would have been caught probably by a reproductive endocrinologist that could have allowed us to possibly bank some eggs, to
Mm.
do some other less invasive methods of trying to have children, knowing, if we knew that, that may have changed our timeline on purchasing a house, on getting married, or these other things. So uh, as we learned more, we realized the warning signs were missed by my wife's OBGYN at the time. We were with a large network um, of integrated clinics that's in California on the East Coast. So people may know
Mm.
the company I'm talking about, but there were warning signs that were missed there. And that was hard for us to accept, that a doctor could have intervened early on and changed our trajectory and maybe allowed us to have more than one child. But you also come to terms with that and know there's so many other factors that go in, it may have not actually changed anything.
Mhm. Yeah. How old were both of you when you started trying?
Yeah, I was in my early 30s, so I was, I think,
Mm.
31 or 32, and my wife's 4 years older than me, so she was 34, 35
Okay.
when we started trying. So, not super old. I mean, I remember the first time I went to
Mm.
reproductive endocrinologist, and my wife gets labeled as a geriatric patient, or
Mhm.
was successfully pregnant back in 2020 or 2019.
Yeah.
She's a geriatric pregnancy and high risk automatically. That was probably a little disheartening for her to hear, considering we didn't feel geriatric in any way. But we do know, obviously, and the statistics bear out, that the older you get, the decreased chances of success and increased chances of multiple cycles.
Yeah, such a terrible term.
Yeah, yes.
Okay, yeah, that's good to know. Just like thinking, I think that's important or interesting for people to hear when you talk about diminished ovarian reserve. Like, what does that look like at what age for different people? Okay,
Yeah.
okay. So tell me a little bit more about your IVF journey. So you did that one cycle. That was your first cycle, and it ended in a chemical pregnancy. Tell me a little bit about when you first did your like egg retrieval. How many eggs did you get? Things like that.
Yeah, so because of the diagnosis of diminished ovarian reserve, we weren't able to bank any eggs. So we actually had to go third party reproduction. So we were very lucky in being able to eventually find a known donor to be able to do eggs. So we had a unique perspective in that, this person who we're very close with, was doing their own egg retrieval process. So I got to see it from the outside and try to help out as best I could from that perspective. But our first several cycles were actually through an egg bank that we had purchased eggs through. So we had to go through that whole process, which, again, to the unique aspect of my journey and the complicating factors of it, there were so many other things we had to deal with as a couple who was using third party reproduction to try to have our child. The added expense of all of that. There's legal requirements, there's counseling, there's other things that individuals are forced to go through it. So that was one of the reasons that our journey became so complicated, and also added a lot of time to it. So the course of our
Mhm.
journey, we had 6 total cycles, 5 of which failed. That was over the course of 4 years, and that was due to a number of factors. That was trying to get the eggs and ensuring that everything was proper, timing cycles. There were multiple cycles that were stopped due to either possible cysts or other stuff in the uterine cavity, as we are trying to prime my wife to be receptive towards a frozen embryo transfer. So all of those things all would lead to a stalled cycle that wasn't able to be completed, and that added a lot of time. So that ended up, causing our journey to be nearly 4 years from the start of it. That wasn't even our diagnosis. That was the start of our first thing all the way through to a successful pregnancy.
Okay, okay, very interesting. Tell me a little bit more about how you made that decision, because I think this is a very like personal decision from, there's a lot of people out there that I think people going through infertility often hear these things that maybe feel a little offensive, or things like, why don't you just adopt, or
Mhm.
why don't you statements, and everybody's decisions are very unique and it's very personal. So like there are options like adoption and things like that. But how did you come to this decision to go the route that you did?
Yeah, I think it's a really good question. And this is one of those parts of the infertility journey that you often don't think about until you're confronted with it. And this is where we always try to preach the ability for patients to have a informed decision and knowing what options are out there. And the reality is, yes, there are ways to be able to have children and expand your family in other ways, such as adoption, but those are not free and those are not easy and those are not quick. The
Right.
adoption process can take a very long time. We talked about possibly fostering as a way, and we both made the decision collectively as a couple that I couldn't do that, and she probably couldn't either, because you get attached to someone, but you're not necessarily guaranteed. And there are so many aspects of this that are decisions where you are weighed with two bad choices, and how do you make the one that is probably the best for you? So, in
Mhm.
consultation with each other as a couple, working with a therapist and talking with our doctors to say what was the best chances of success, and using third party reproduction was the best chance that we had. We didn't think there was anything that necessarily said that my wife wouldn't be receptive or able to carry a pregnancy. It was just
Mhm.
that her eggs had already been diminished due to a number of factors. And so there was nothing preventing us from doing that. So we had to figure out what was that missing part of the equation, and to do it that way. And I'm an analytical person, and tried to think of it this way. And this is, I think, a thing that I always tell people a lot, that it was probably a mistake to be that analytical about something that is, there's so many variables, but there's also so much luck and art to it as opposed to just skill and straight science. So
Mhm.
it was trying to think through that. That's the way that we were approaching all of this. And we were very lucky to, one, be in a state that had a coverage requirement. I'm located in Maryland, so insurance does cover a portion of what we were doing. But then,
Mhm.
two, we had the economic means to be able to pursue third party reproduction, knowing that there's a lot of out of pocket costs with that. And then, three, that I had the ability to help us from the administrative ends with my background being in healthcare policy, having worked with insurance companies for a long time, worked on Capitol Hill, worked on the crafting of legislation. I understood how to talk with insurance companies, how to
Mhm.
negotiate with clinics, how billing processes worked. So all of that kind of weighed into what was the best decision for us, knowing our resources and our abilities, and what was the best chance for us to have a child.
Okay. Yeah. Yeah. Very interesting. I think it's very important people to understand that, and people that make those comments don't have the education typically to understand the financial burden of IVF or adoption and all those things.
Yeah.
Um, Going through your journey, was there ever, speaking of that, was there ever things that came up that people said to you that was hurtful going through your journey?
Yeah, I mean, I think when we were going through our journey, so just for timeline for the listeners and viewers, was 2016 was when we started our first cycles, and then up to 2020 when my daughter was born. So that's that 4-year timeline that we were talking about earlier. And as we went through that process, there were a number of times that I think things that happened that we became more vocal around 2018, 2019, and partially that was because the therapist that my wife and I were seeing recommended I start to become involved with Resolve, the National Infertility Association. So I, using my background in health policy, wanted to give something back to the community and to help expand coverage to ensure that people who didn't have the financial means could afford treatment. So I started going to Capitol Hill, and you're
Mhm.
talking with lawmakers who aren't necessarily supportive of this technology, and some who are, which are outright opposed to it. But is our job as advocates and patients to explain to them the realities of this. And one, that infertility is a disease. This is not a voluntary thing that we chose to do. We weren't making a designer baby. We weren't a celebrity who was using surrogacy as a means to have a child because I wanted to be able to continue a reality show or a movie that I was in. It was the reality that we were not able to have a child on our own, and in vitro fertilization is the only means possible for us to do that, with my wife carrying.
Mm-hmm.
So explaining that to lawmakers, and you often get puzzled looks or outright opposition saying that they are morally opposed to it. So you hear that from people when you're doing that. But
Mm-hmm.
a particular story that always comes to mind about this, and this is why I'm so vocal about being an advocate for patients to speak out, is when when my wife was pregnant, we had to get a fetal echocardiogram to ensure that my daughter's heart was functioning fine. And this is a requirement that a lot of people have to go through who are utilizing IVF. There's some data that shows, there's an increased risk of structural heart issues, et cetera. So as we go to the cardiologist and they're doing the echocardiogram, through an ultrasound, the cardiologist makes a comment because we disclosed that we had used a donor, and he made a comment essentially saying that, oh, the donor must be very proud, about having a baby. And my wife was like, no, this is our baby. Like, this is not, this was, and so you could instantly hear, and it was, we finished and started crying immediately afterwards. And it was one of those things, but you realize that this doctor should have known there, but
Yeah.
probably never actually experienced that, and they didn't know
Yeah.
how to do it. And so I decided to utilize that story as a means of educating people for what are the proper ways to talk to patients like this. I'm working with associations like the American Society for Reproductive Medicine to help craft new educational modules to teach doctors the proper way to work with patients. What are the best ways to be respectful to
Mm-hmm.
There are numerous instances. I think social media can contribute to a lot of that as well, especially if you are vocal out there, in whether it's advocacy or support or just outright, awareness for a disease like infertility. You get comments all the time from people who are opposed to you, et cetera. And today's political climate, I think, has amplified some of that.
Mm-hmm.
So
Right.
unfortunately, that's, a reality of what we have to go through. But we're working to try to raise awareness to educate those people. Just like mental health, there used to be a stigma surrounding it, that infertility is a disease. We should provide patients with the means to treat it medically and give them the support that they deserve to ensure that all of their needs are adequately supported as they go through the process.
Mm-hmm. That is a very interesting story, especially coming from your doctor and not necessarily like a cousin or something like that that didn't understand what you were going through, but a doctor that made you feel like that. And not every doctor is gonna make a comment like that, but it's interesting coming from that perspective
Mhm.
that you were made to feel like that from a medical professional,
Yeah.
which is interesting. Okay, okay. Um, Tell me what it was like to, after everything you went through, what was it like to finally be able to hold your daughter in your arms for the first time?
So I mean, one, it was amazing, but two, because keep on talking about how strange my story was. My daughter was born in April of 2020. So this
Oh
was the
my
very start of the COVID pandemic.
God.
So we had gone through 4 years of trying to have a child, and then we were trying to figure out, could I even be in the room? Where was
Mm.
I going to be as we went through the start of a pandemic? We'd actually made plans to travel up to Connecticut, where my wife's uncle, he's an OBGYN. We were going to stay at his house and then have her deliver at his hospital. So at least some family member could be there with
Mm.
her through the process if they had, prevented us from doing it. Luckily, Maryland never did that. I know New York did that very shortly. So
Mm.
that was complicating, but also my daughter came 1 month early. She was
Mm.
premature. So she was born at 4 pounds, 9 ounces during a global pandemic. We were given the choice of you can stay at the hospital for a day or two more, or you can go home. But the doctors think it's probably safer for you to be at home and isolate. We narrowly NICU, but throughout the entire time, I just couldn't believe that it had happened after everything we had been through. And so much of the pain and anguish that we had suffered as we went through our journey, the failures, the self-doubt, we were on our last viable embryo. Our daughter was our last chance. And we had both decided collectively we couldn't do it anymore. We were going to stop treatment after that. We couldn't financially do it, emotionally, physically. It was too hard on us as a couple and individuals to continue to go through this process. So
Mhm.
it's a miracle in that regard. So for anyone who is struggling out there, who knows this process and this feeling, to know that those of us that are lucky enough to have emerged on the other side with success have been in those exact situations, to know how hard it is. And it's frankly the reason why I decided to continue to advocate for expansion of care, for the promotion of awareness for infertility, for talking as both a spouse and a partner, for being able to support, and then frankly why I started a company to help patients, because I look at my daughter and know how lucky I am to have gone through this process and been successful, when there are so many people who unfortunately don't have that,
Mhm.
and they have their own journey that they have to resolve as they go through, or there are people who are going through and trying to make that decision right now. And I'm not saying that you should continue treatment because Joe Cody said that he had a child and he was successful despite
Right.
everything. That's absolutely not what the message should be. Every
Mhm.
person should make the decision that's right for them, to ensure, what's the best thing for them, their partner, spouse, loved ones, family, et cetera.
Absolutely.
There's so much that goes into this process.
Right, definitely. Yes. That's part of why we're talking about this, is to
Mhm.
help people feel less alone, or relate to your journey and give them hope, if they choose to continue on their journey, if that is right for them. Okay, that is crazy that after all that you went through, that your daughter was born. Did you say in April? In
Yeah,
April?
April. Yeah, April 14th. So she
April
was
14th.
1 month after the world shut down, when like Tom Hanks got COVID, the NBA shut down, like all of that was literally 1 month before. And,
Yeah.
my wife had just started to get preeclampsia around that time. So we knew that like the clock was starting to tick. So it may have been, the pandemic may have exacerbated some blood pressure issues
Yeah.
for a few of us. So yeah.
Definitely, definitely. Yeah, so you were able to be in the room then?
I was very
Okay,
lucky in that our hospital did that. And
okay.
actually, it was crazy because our hospital is actually down the street from our house in Maryland. And
Mhm.
uh, I thought for sure we'd be locked in, like basically quarantined in the hospital for the entirety of it. But they were letting me come and go too. So I was actually able to cook meals and bring them into the hospital room, since the
Mhm.
hospital was 5 minutes away. So,
Amazing.
while we were waiting, for her to come, rather than eating hospital food, I was able to go home and cook meals, which I think my wife appreciated, being able to have a
Yeah.
really nice like egg sandwich, or, a good bagel, or a good sandwich from a local deli, or something like that, as we
Mhm.
went.
Definitely. Hospital food is not the
The worst.
best.
It's not.
So tell me a little bit about what it was like. You mentioned a little bit of this going through, as we've been talking so far, but from a male perspective, what was it like for you? Because there's a lot of, like you said, there's a lot of that burden on the woman who's going through infertility. And sometimes it's male factor too, right? But tell me from your perspective, what was it like going through infertility as a husband?
Yeah, it was one of those things where I could see the weight on my wife and how much she was dealing with emotionally, physically, between the medications, the hormones, the appointments, the blood work. Like that's a draining component. And then having to do all that stuff before going to work every morning, doing those monitoring appointments that people who are listening know about the struggle that deals with. So my whole thing was I saw how much it was weighing on her. And then further complicating things, again, talking about our journey, was my wife's mother passed away from metastatic breast cancer right at the start of our treatment. We had gotten the diagnosis in earlier in the year, and then my mother-in-law took a turn and she was starting to go downhill. So we knew that she was most likely never going to get the chance to meet our daughter or son, just because the diagnosis was and the prognosis was not good at that point. So trying to navigate early fertility care while dealing with a sick parent and trying to spend as much time with them as possible, was incredibly hard for her. And I saw that and wanted to do everything I could to make that burden slightly less. So, trying to do the administrative stuff. There were phone calls that had to be, if there are prior authorizations that you had to do, and the holds that we all have with medication companies, we had to have a specialty pharmacy that was compounding our medications, putting on hold and waiting for that, then ensuring what was the pricing and billing going to be, dealing with all of those things, medical or medical record requests. That was something that I knew what the rights were with my perspective. And, I was able to try to do all that. And that's what I told her. Said, I want to take on as much of that. You tell me what to do. You tell me how I can help, because I want to ensure that you are in the best mindset possible with the least amount of stress to try to make this as successful as possible, so you can focus on what you need. Too often people are told, just relax, like stress less, it'll work and stuff. And,
Yeah.
there is something to that, though, to a degree, because we do know that people who have higher stress levels do have less success in getting pregnant, both in vitro fertilization or outside. So
Right.
there are ways that, we as spouses or partners can try to support someone. And sometimes it's also just being there, being that punching bag or being that sounding board for someone, knowing that, they are going through a lot, and there are times where they just need someone to listen to them. They need to vent, or there are times you just need to get away from them. They need to be isolated and alone, just to have time to process everything. So I didn't take anything personally. I think that it's one of those things, when we look back at it with our marriage, that it has made us a stronger couple together. If you can get through that, I think you can get through pretty much everything together. And that's the way I viewed my role, as trying to help in any way I could.
I think that's an important conversation to have with your partner. And when you're going through that, like, what what can the partner that's not going through the treatments do to help support? And what what burden can be taken away from the partner that is going through treatments? So that's great that you did that. And I think that says a lot about, like, your relationship, right? Because, like you said, if you can get through that, you can get through anything. So those tests on your marriage and your or a partnership can say a lot
Yeah.
about how strong it is. Um yeah, okay, wonderful. So tell me a little bit about, so obviously you've mentioned this a couple times throughout the time we've been chatting, but you are obviously super passionate about IVF advocacy to the point where you even started a fertility company. So tell me a little bit about how that whole process happened. And I just think it's so great that um you took this experience that you had and turned it into something where you can help others going through that process. And especially as um like a lot of, like we've been talking about, a lot of fertility fertility related things happen through women, or fertility companies maybe are founded by women. So I think it's really great that you are so passionate about this, and you decided to continue helping people. So tell me how you arrived at wanting to do that.
Yeah, it really actually starts during our IVF journey, and there's a couple things. So one, as we were going through everything, care coordination and getting help and navigating the complexity of our situation was one of the harder parts of the journey on top of the physical, emotional, etc. But having to deal with all of that and trying to manage 6 different doctors that were treating my wife as she was going through. I mentioned a couple of the things that she has, her Crohn's disease, thyroid issues. So you have your endocrinologist, you have your reproductive endocrinologist, OBGYN, primary care physician, gastroenterologist, urologist, et cetera, like all these different doctors that we were all working with to try to figure out what is the cause of this. But they all needed to know what was going on as we are going through the process. And the genesis of what became Grand Fertility was really what my wife created, which was a 3-ring binder, and started carrying it around to all of her appointments. We started printing out our test results. We would write down the daily, results that we would get to ensure that we had them accurate, and to make sure that we had them in one place, because they were spread out over different, the lab company or the patient portal from our fertility clinic. Other stuff from, the other diseases that my wife had were in her other doctors' portals, etc. So there wasn't one place for everything to be. And there are so many people that we talk to that they experience the same problem, that there's information spread out across the entire ecosystem. And then so we kept on saying to each other, like, this is crazy. We're using a binder. This is 2018, 2019. Why are we doing this manually? There has to be a better way. And as we were doing all of this, I was starting to become more and more actively involved with Resolve, the National Fertility Association, and I ended up leading their advocacy day in 2020 and 2021. But I was state captain for Maryland around this time, and a lot of this at the advice of the therapists that my wife and I were seeing. She recommended I get involved as a way for me to deal with the trauma of infertility and to give something back to the community. She thought that would be a very productive way for me to continue to move forward. So all of this eventually led towards, in late 2020, we're sitting around during the pandemic, probably having a glass of wine, sitting at a table, as the 3 of us, and my daughter was a few months old. And I just couldn't stop thinking about all of the other people who were going through this and who weren't on the other side of it like we were, and the problems that we experienced, and there had to be a better way. And one day I literally just told my wife, I was like, I think I want to start a company to do exactly what we talked about, to solve the problems that we experienced in trying to navigate the complexities of care, having someone to talk to who can help you understand what all of your results mean, having someone who can provide you with the information so that way you have a more informed conversation with your doctor. You understand the components of your journey. We're lucky in that I have a master's in policy, so I was able to navigate some of the complexities, but you shouldn't have to have that degree of education to understand how your insurance works. So Grand Fertility is really the outgrowth of all of that, where we were hoping to be able to put together a resource that helps people access, organize, and use their health info. And we connect them with health professionals and other experts in the field who can help them understand what their information means, provide them with the support they need. And that's how you and I met, because nutrition is an important component of this, where we were trying to figure out ways, how do you reduce inflammation with a Crohn's disease diagnosis? It's a really diet is a very big piece of what we were dealing with. And we did not have resources. Our clinic was not providing us with that type of stuff. So Grand Fertility is really hoping to be able to build this ecosystem to connect patients with trusted experts in the field who can help them with the different aspects of their journey and ensure that all that information is easily accessible in one place securely.
Wonderful. I think that's so amazing that you're so passionate about this and helping others, that you're able to turn it into a business, and be able to help others. So my last question for you is, what advice would you give couples going through this?
I think there's a couple of things, and I alluded to it one earlier on when I talked about how I'm very analytical, and I was thinking of IVF as a series of variables, and if we can account for unknowns, you can reduce variation and increase your probability of success. That was probably the wrong way to go about thinking of things. So understanding that there is luck and art to assisted reproductive technology, and it's not just a simple thing of you have that you male factor infertility, we can do a couple things, boom, you're going to be pregnant. That's not the unfortunate way that this works. And then two, just to continuously remind yourself that it's not your fault, to give yourself grace as you go through. There are so many times where, you know, we would look at each other and just like, God, how did we get here? Like, what happened? Like, why are we going through this? Like, what did we do? Did we do something wrong? Like I mentioned, the stuff that we'd realized after the fact that we missed. Could we have done something different? And there's that degree of doubt and blame that goes into this. So remembering that infertility is a disease, much like cancer, much like depression, mental health, much like obesity, diabetes, all these other diseases that we know people are working to treat, especially chronic diseases, infertility falls into that same bucket. And we need to ensure that it's looked at that way. So those are two things that I tell people, often as they go through the process. And then the third is be an advocate for yourself. Often we trust our doctors, but we often trust everything they're saying to the point of we don't actually take the time to understand what it means and contextualize it into your own care so you're comfortable with the decision being made. Infertility treatment can often, you feel like you're a passenger on this bus that's taking you to an unknown destination, but we need to have a little more information about what's the bus that we're on. Like, what
Right.
road are we taking? Like, who's driving this bus? Like, these are
Yeah.
all things that you can do a random car and do that stuff. So
Right.
infertility is the same way. So I think being an advocate for yourself, it is not a bad thing to ask questions to your doctor and to
Yeah.
say, why are you doing this? Most patients, and I think data shows like 3/4 of patients leave doctor's appointments, and this isn't just fertility related, not understanding the information that their doctor provided them in that appointment. And they often do not ask follow-up questions about it. So how can you as a patient make an informed decision on what's best for you, for your spouse, partner, loved ones, if you don't understand what's going on? So I think those
Right.
are the three things that people can do that will really hopefully help the journey a little bit more and allow you to focus on yourself and just feel more comfortable and confident in what's going to happen next.
Yes, that is such good advice. I agree with all that you said, but I especially agree with being your own advocate is so
Mhm.
important because we often think about, your doctor as being somebody who has your best interests at
Mhm.
heart, and hopefully they do, and a lot of doctors do, but sometimes we forget that we're not gonna be for everybody, right? Like,
Mhm.
you're not gonna be best friends with everyone in the world, you're not gonna vibe with
Mhm.
everyone. The same goes for your medical care and your fertility care. So if you leave an appointment feeling like, "That didn't feel right, I don't feel like this is the doctor for me," then you should find another doctor,
Mhm.
and try to find somebody that you feel really supported by, um and that is going to make your experience better. And that can be difficult for some people because some people live in rural areas and they don't have a lot of access. But if you do have that option to find somebody that you really vibe with, I think that is so important. So I'm glad you brought that up.
Yeah.
Advocate for yourself.
Advocate for yourself. Exactly.
All right, Joe, wonderful. So tell everybody where they can find you, connect with you. Maybe talk a little bit about if somebody wants to become an advocate like
Yeah.
you, how you can do that, about grain fertility, all that.
Yeah, sure. So first off, I will say, anyone who is listening to this, I understand that it's an incredibly scary thing to try to tell your story. But if we're going to get to a place where people accept infertility as a disease, we're going to educate lawmakers, policymakers, etc., in ways we need to be out there telling our stories. Doesn't mean you need to be all over social media, posting every update you have, etc. Some people do that as therapy. Some people are doing it for other reasons, and they're trying to help other people. Doesn't have to be you. However,
Hmm.
I do think it's really important for people, and advocacy I think is a really big key to everything that I'm trying to do, in both the policy world but also in personal care too. So I think if you have any questions about that, you can find me on social media. I'm on Instagram, I'm on Facebook. I used to be on Twitter/X, but I quit that for my own mental health. I'm trying to prioritize
Yeah.
a little bit more. But like on Instagram, you can find me at Joe Cody 5, at Great Fertility. But if you're interested in trying to understand the resources that are available to you as a fertility patient, whether you're just starting treatment or you've had a long journey and you're trying to figure out what's next, Grain Fertility has the ability to help you as a patient. We're not tied directly to any clinic, but we're able to be that support structure for you, that advocate to help you talk about what we were just talking about, ensuring that you have the resources and education you need. So you can go to our website at www.grainfertility.com or find us on social media. We offer free consultations with our fertility nurse that can help answer questions and see if it's a right fit for you. We know, just as Becca said, not everyone is always going to mesh, and we are completely okay with that. But what we do want to do is help you in any way we can and connect you with resources and trusted experts that can help you navigate the complexity of the journey, because you shouldn't have to be an expert in every single component of your health in order to navigate a complex disease like infertility. So those are two ways that I think, people can reach out to us any way we can help them. And, I appreciate the ability to connect with people like you, Becca, who are one, raising this platform for people like me to tell our story, to be able to show people that, this is something that 1 in 6 people in the United States, 1 in 5 globally will experience as they go through the course of their lives. There are millions of people who are struggling with this, and we shouldn't have to suffer in silence. So I appreciate, the ability for you to let me tell my story, and the ability to, for you helping people, because it really does mean a lot that there are so many people in this field who are trying to do it for the right reasons. They really do care about patients.
Yeah, wonderful. All right, everybody go follow Joe and Grain Fertility and check out Grain Fertility if you're going through IVF. It's a super helpful tool. Thanks so much for being on today, Joe. That was awesome to learn more about your story.
I appreciate the ability to tell it. And thank you so much to you and everyone who is listening. And if there's anything I can do to help out people, even if you don't follow Grain, please reach out to me. I want to be able to help people as best I can. So thank you.
Awesome. Thank you.